You know, athletes are obviously prone to injury, but did you know the female athletes more so than male athletes? John Pierson examines this and treatment of those injuries with the specialists at Gaylord Hospital.
Research shows female athletes are 8 times more likely to suffer an ACL injury than their male counterparts.
That tends to be the injury that we see a lot in young female athletes is an ACL tear. Sometimes that is combined with a tear of the MCL and the meniscus, some other tissues in the knee joint.
The injuries Amy Morocco and the other specialists at Gaylord Hospital see vary, with the knee at the top of the list. Girls' ACLs tend to be at higher risk. It's just how they're built.
The young female athletes tend to have really strong quads, which are the muscles, the big muscle group in the front of the thigh. So those muscles tend to be very strong. And if you can see here, these are the quadriceps muscles. They attach right on the front of the lower leg, the shin bone here. So if these muscles are very strong, and what happens is it ends up these muscles contract and it pulls forward on this lower part of the leg here, and that's exactly how an ACL injury would occur.
Why females have stronger quads is up for debate. One theory is that women decelerate and cut while running in a more erect position, and they land with less bend in their knees when jumping. Whatever the reason, the majority of ACL injuries are of the non-contact variety.
Essentially what happens is, someone is running along and then they're going to stop, they're going to plant their foot, and the quads are going to work very quickly to slow down that motion. So already they're engaged, and then if you're going to change direction, your foot is planted, you turn, and now you've got a strong contraction here to slow you down, plus a rotational force, which is pretty much a recipe for disaster.
At Gaylord, specialists work to prevent and treat disaster. Adam Williams is a licensed sports metrics trainer. Getting to females before injury does is Williams' job.
If her knee were to come in when she's landing on a jump, and if it was like that, that'd be pretty significant, then she would be at a high risk for an ACL tear.
Assessing individual athletes leads to a personal training plan.
Jump down and then jump back up instantly. Good. And so if Jenny was actually pretty good at this. So if Jenny were to have jumped up and you saw her knees go in a lot when she landed, more like this, then that would be a sign that she is pretty high risk of tearing her ACL.
Williams works with athletes from 10 years old up to 21. The earlier he can begin strength and conditioning, the better.
It's the first scientifically proven program to help decrease the incidence of non-contact ACL tears in female athletes.
If you can't prevent them, you can treat them. Therapist Eric Lagoy sees patients pre- and post-surgery, laying out their road to a full recovery.
If you just tore your ACL, we're going to assess what sort of limitations you have since that injury. Is there still in what we call the acute phase, so is there still a lot of knee swelling, pain, limited range of motion, and if those things are there, we want to restore that the best we can.
Treading lightly until the athlete heals is a must.
There's general guidelines, so if you had a ACL surgery, there's a certain time frame for the ligament that they're repaired to heal to the bone, and during that time frame, like that 8 to 12 week time frame, you have to be careful to not overstress that ligament, potentially compromise it and have a rupture.
Once cleared, Lagoy says treating a female athlete is really no different than a male. The misconception that females can't do what males do is old school, Lagoy says.
Injuries are normal in sports, and they're really, depending on the type of injury, they're going to happen. And it's our job to make sure that they return back to their previous level of function.
For the Sports Edge, I'm John Pierson.